The flowerhorn cichlid is one of the most popular aquarium fish with a very interesting behavior, temper, and completely unique appearance. They have a great personality and you will not regret keeping these fish as a pet. The flowerhorn is man-made hybrid fish, that means, they are not found in the wild. As these fish are hybrid fish, they are vulnerable to many diseases. Therefore, you should always set up the aquarium the right way, as the right water parameter and the right tank's environment is the key to healthy flowerhorn fish. Hello everyone, welcome to Fish Keeping Guide. Today I want to go over with top disease that you flowerhorn might suffer from and how you can treat them. I have been keeping flowerhorn for many years now and he is Jack, my buddy. He has got sick many times and I have been able to cure those diseases till date. Let's start with flowerhorn diseases and treatment. First off, we have hole in the head diseases, HITH, or head and lateral line erosion, HLLE. In the medical term, this disease is called hexamida. In a sense, it is caused by flagellate parasite called hexamida. There are several conditions that could lead to this disease, some of which are poor water quality, use of activated carbon, flagellate parasite hexamida, and low immunity of the fish. If you spot the disease in its early stage and start treatment right away, your fish will survive. When the fish suffers from hole in the head disease, he will lose his appetite, he will not be accepting any form of food, making it difficult to treat. You can use the metronidazole treatment for this disease. So, first you will need to replace 75% of your tank water, and remember the fresh water need to be at exact temperature of your tank's water or else your fish will be stressed. If your fish is accepting food, you can crush 1/4 of metronidazole tablet, soak it to the palate and feed your fish. If your fish isn't accepting any food, try force feeding fish through a syringe. Be extra careful when inserting the syringe, it might hurt the fish. And add 250 mg of metronidazole per 10 gallons of water. Now, all you need to do is repeat the process every 2 to 3 days until your fish is cured. Next, we have swimming bladder disorder. This disease is caused when the air bladder doesn't open normally and the fish will have difficulty in swimming. If you don't give your attention right away, it may turn into devastating situation for you fish. You flowerhorn will not die from this disease, however will causes stress in the fish, opening door to many of other fish diseases, causing your fish to die eventually. The best treatment for this disease is to keep the water clean and temperature between 78 and 80 degrees Fahrenheit. Next, reduce the water level and water flow in the tank to make it easier for the fish to move around in the tank. Now add a small amount of aquarium salt to the tank. You will need to force feed your flowerhorn if he is not accepting any food. The next disease your flowerhorn might suffer from is fungal infection. Fungal infection is a very common disease among tropical fish. The fungus quickly develops inside the water and around the environment that could be hazardous to the fish. Usually, the fungal infection only affects the internal tissues. The characteristics of appearing of white fluffy substance in the surface of the fish are known as cotton wool disease. If the condition gets worse, it can turn into gray and red. Causes of fungal infection in flowerhorn are: poor water condition, an increasing amount of decomposing organic material, the dirty environment inside the aquarium, high possibility if the fish is injured, and if your fish is old, then low immunity can also cause the disease. So, to treat fungal infection you will need to have clean and hygiene tank environment. The fungal infection seems to affect more on weak and injured fish. Keeping the fish in proper condition prevents fish from catching the fungal infection. Some necessary steps to follow to avoid the fungal infection are: changing water frequently, testing water quality, maintaining water temperature, check for any contamination, don't add fish you just bought to the tank, and avoiding decomposing organic material. The next disease your flowerhorn might suffer from is the white spot disease or itch. Itch is caused by Ichthyophthirius multifilius, a protozoan parasite. It develops rapidly in warm water. The disease is mainly brought into the aquarium through the addition of new fish, new plants, or foods. The symptoms of itch are: white spots appear on the skin and fins, loss of appetite, higher gill movements, fish restless at the bottom of the aquarium or tank, and reddening of fins. The best way to treat your fish with itch is to isolate the fish to a hospital tank. As these parasites can affect your tank, you will need to clean the whole tank and equipment with medicine like formaldehyde and copper sulfate. Next, increase the temperature in the hospital tank to 77 to 86 degrees Fahrenheit, as the parasite develops rapidly in warm water. Other methods, such as adding salt, and changing the water are also used by fish hobbyists to treat itch infection in an aquarium. Next disease on my list is bloat. It is the condition which is caused by overfeeding and constipation. Bloat is not an actual disease but symptoms to more severe disease. The major change we can find in the fish with the bloat is a swollen abdomen and irregular swimming pattern. The cause of this disease are low immunity of fish, poor water quality, and overfeeding. Likewise, the symptoms of bloat are swollen abdomen, irregular movement patterns, fences trailing in the back, and bloat appearance. The basic way to treat constipation is by providing less food for a while and replacing the tank water regularly. This protects and reduces the chances of exposing fish to too many diseases. Some basic treatment measures are changing of water in aquarium and pond, withholding of the foods being served. These steps don't guarantee the cure because bloat is the symptom of another disease. This could be the cause of different conditions like internal organ damage, tumor, intestinal blockage, or other. After trying these steps, if no improvement is seen, consult a veterinarian. Next we have pop-eye disease. Pop-eye, medically called as exophthalmia, is a condition in the fish where the eyes are swollen and seem popped out of the eyelids. Some fish species like black moor goldfish and the celestial eye goldfish have the eyes that are popular for their big and bulky eyes. However, pop-eye disease is different, and this condition may result your fish from losing its eyes. Some of the major causes of this diseases are poor water condition, bacterial infection, internal organ damage, like kidney failure, metabolic issue, and level of supersaturation of gas in water. The treatment of pop-eye will be different according to the case. If the cause is an injury, you should treat the fish by aquarium salt in the water until the eye returns to its natural state. But if the cause of the disease is bacterial infections, put the fish in quarantine so that the infection doesn't get spread to other fish and treat the fish with broad-spectrum antibiotic food. If more than one fish is infected, then treat the whole tank with the broad-spectrum antibiotic food. You should maintain your water, change it regularly, and test it for any infection in a routine period of time. If any abnormal situation happens with pop-eye, consult a veterinarian. With that, we have come to an end of our video. So, what are the diseases you have come across in your aquarium, and what methods you use to treat them? Let us know in the comment section below because we love hearing from you. Well, that's all for today. Thank you. Until next time.